Welcome back to Up Close. Talk, honest talk, any kind of talk. That's what's needed most about the subject of our next segment. It is Mental Health Awareness Month. Time to talk about mental health, because it is still very much a kind of in-the-closet disease and medical condition. Exactly why is that? First, the stats are alarming. 500,000 New Yorkers suffer from depression. Fewer than 40% actually receive help. And this is staggering. $14 billion lost in productivity to people who suffer from mental illness. So why are we so hesitant to talk about mental illness and about mental health? Joining me this morning, Kimberly Williams, president of the Mental Health Association of New York City. Why are we so hesitant? Why is it so still, after all these years, taboo?
I think people are reluctant because they fear stigma. They don't really necessarily understand that they need help. They don't understand that treatment's out there, that it's effective, that they can get support, that they can reach out to family and friends who will listen and get them connected to resources.
Okay, but what about the family and friends who clearly see someone has a problem? And, you know, we intervene all the time for substance abuse, for other kinds of problems, for medical problems. Why don't we become more aggressive and emboldened about intervening with mental health?
Well, I think if a family member or a friend is concerned about somebody that they care about, that they should speak up and that they should reach out. The fact is that any of us can take action to support someone who's in emotional distress. So they should just ask, are you not feeling okay? Are you thinking about killing yourself? Ask them bluntly and directly. And then
it's hard for a lot of people to do,
yeah,
right?
but the point is that you're reaching out and you're showing that you care. And if they are at risk, if they are experiencing a challenge, if they are suicidal, then you want to make sure that you protect them, you keep them from harm. So separate them from things that put them at risk, particularly if they have a plan in place. And then you want to be there for them. You want to listen. You want to express understanding and empathy. You want to listen for why they're feeling like they're in pain or they're hopeless. And then you also want to help them connect. Help them connect to other resources, either to a crisis line like NYC Well, which we administer in partnership with the city. Anybody can call 24/7. Help them connect to other families and friends. You want to help them connect to a social support network so they can reach out for help. And then you want to follow up with them. You want to call them, reach out to them.
A lot of people don't know what to say. I want you to repeat that number again, because I think if someone's listening and you connected with them, you want to hit them right now when it's important.
Absolutely. If you are in crisis, if you're experiencing distress, if you're concerned about a loved one, a neighbor, a family, a friend, reach out, call 1-888-NYC-WELL. This is available 24/7, providing crisis support, suicide prevention, information and referral. Anybody can call anytime, day or night. Talk to a trained counselor, get the support they need, get connected to resources, and if they choose, also get follow-up. So they'll call them back, make sure that they got connected to the care that they need.
I know this is a very important issue to the First Lady of New York City, Chirlane McCray, and you have partnered with her in City Hall to some degree. What are you doing?
Yes, so we, in partnership with them, we are operating NYC Well, which is New York City's front door to accessing behavioral health services. This administration has made an unprecedented commitment to providing access to behavioral health for New Yorkers, $850 million multi-year initiative that is really about providing access and quality to New Yorkers of all walks of life, from those who are very young to those who are very old, to those who have mild to moderate conditions, to those who have more serious conditions. And so we're very proud to be able to partner with them on a number of initiatives.
Kimberly, you've been in social service field for a long time. Where are we in terms of treating mental illness now compared to when you first started a couple decades ago?
Well, the fact is we've made progress. We've increased access to services, we've improved quality, but the fact is we need to be doing more. 1 in 4 individuals have a diagnosable mental health or substance use condition in any given year. 50% will experience a diagnosable condition over their lifetime. These issues impact every one of us, whether personally or their family members or their friends, and yet less than 40% get treatment. So we have to be doing more. We have to be improving access to care. And we have to realize that this is going to require political will and a financial commitment.
This condition, along with so many others, of course, but this one, to be sure, it certainly can be considered a pre-existing condition. I know that this last week you followed closely the vote in the House to repeal Obamacare. It doesn't mean it's over. It's going to go to the Senate now.
Right.
How is this going to impact people who you treat and who are seeking mental health treatment?
Well, we're deeply disappointed that the House moved forward with passing this bill. This is going to result in millions of Americans losing access to care. It is going to result in dire consequences for those who have protections, who have mental health issues and have had protections under health insurance. The fact is that they're going to strip away expansion of Medicaid. There are going to be challenges and changes to Medicaid, and Medicaid, in fact, is the largest payer of behavioral health services in this country. Millions of Americans rely on Medicaid for accessing community mental health services. And then there's up to the states now to whether or not they're going to actually require essential health benefits, which includes access to mental health. So this really has serious consequences for individuals with mental illness.
Which is why you guys are watching it so closely, along with so many others. Before I say goodbye, my honor to MC for a second year your gala on June 7th, 25th anniversary gala. Tell me what I'm going to do there. Tell me what the purpose of the event is.
Well, we're so delighted that you're joining us.
Well, my honor.
Yes, and the purpose of this event really is to focus on a particular issue, highlight a particular issue. The theme this year is just talk about it. So it's really focusing on people who have come forth bravely and honestly to talk openly about mental health challenges, providing help and hope and recovery to so many people in need. Okay, Kimberly Williams, with the president of the Mental Health Association of New York City. Thanks for joining us, and I'll see you June 7th. Yeah, looking forward to it. Thanks, Bill.
Kim. Finally, speaking of talk, we have discussed this morning mental illness, gang violence, education. Very real issues affecting real people. Discussed is the key word, as Kimberly just said. Talk about solutions. We have in so many ways become accustomed to just ranting, whether it be in person or on social media, and oftentimes not really listening to one another, not discussing. This program tries to do that every week. I hope we succeeded this morning, at least a little. And that's it for Up Close. Ciampa with Joe Torres is next. If you missed any of today's programs, no worries. You can catch it again on our website, ABC7NY. Thanks you all for watching. I'm Bill Ritter, and for all of us here at Channel 7, enjoy the rest of your weekend.